intervillous space is filled with maternal blood vessels, and this chorionic villi, it is containing the fetal blood. So we can say the intervillous space is filled with maternal blood and the villi is filled with fetal blood. Now we can see the structure of placenta from amnion, which is forming the innermost layer, the amnion that is forming the fetal part amnion, then the extraembryonic mesoderm containing fetal blood vessels, then cytotrophoblast and then syncytiotrophoblastic, and these all form the chorionic plate. Then comes the intervillous space which contain the maternal blood, and then comes the basal part or the basal plate which is formed by the maternal component. And this cytotrophoblastic is extending and it is forming the cytotrophoblastic shell. This is the cytotrophoblastic shell, and this divides the syncytiotrophoblastic into two parts. The outer part of the syncytiotrophoblastic is called as Nittabach's layer, which undergoes fibrinoid degeneration, and inner layer of the syncytiotrophoblastic is called as Rohr's fibrinoid stria. And the intervillous space is filled with maternal blood, and the extraembryonic mesoderm or the chorionic villi, which is entering into the chorionic villi, is containing the fetal blood vessels. So villi has fetal blood and the intervillous space has maternal blood, and they are separated by this wall of the villi, and this will form the placental barrier or the placental membrane. So now if we discuss the components of the placenta, there are two components. Fetal component is called as chorion frondosum or the chorionic plate, and the maternal component, that is called as decidua basalis or the decidual plate or the basal plate. Fetal component formed by the amnion, extraembryonic mesoderm containing blood vessels, cytotrophoblast and syncytiotrophoblastic, and decidua basalis, which will form by the stratum spongiosum, then the outer syncytiotrophoblastic, outer cytotrophoblastic shell, then the inner syncytiotrophoblastic. These are the layers which will form the basal plate. Now what is decidua and what are the changes occurring in the endometrium during formation of placenta? So when there are changes occurring in the endometrium for providing nutrition to the baby. So the endometrium is in a secretory stage, and it is edematous, and there is decidual reaction. First, what is decidua? I have told you that decidua is nothing but it is the endometrium of the uterus after implantation of the baby. After implantation of the blastocyst, it is called as decidua. So endometrium after implantation is called as decidua, and this decidua has been divided into three parts. Decidua basilis, which is related with the embryonic pole of the blastocyst. Decidua capsularis, which is covering the embryo just like a capsule, and the decidua parietalis, which is lining the uterine cavity. Here you can see the decidua. The part of the decidua which is related to the embryonic pole is called as decidua basilis. The part of the endometrium which is covering the embryo, that is called as decidua capsularis, and part of the decidua which is lining the uterine cavity is called as decidua parietalis. Now what is decidual reaction? So in decidual reaction there is preparation for implantation for nourishment of the baby. So the cells of the stromal cells of the decidua, they become enlarged in size and they become polygonal in shape, and they collect glycogen and lipid for providing the nutrition to the baby. And now these stromal cells are become enlarged, and this reaction is called as decidual reactions. So in decidual reaction, what happens? The cells of the connective tissue of the endometrial stroma or the stromal cells become enlarged and polygonal, and they stores glycogen and lipids. This is called as residual reaction. Now what the formation of chorion frondosum and chorion levi. Here in this diagram you can see this is decidua capsularis, and you can see in this diagram there are some finger like projections from the chorion are extending all around the chorionic sac. So finger like projections from all around the chorion they are arising all around the chorionic sac, but the projections on this side which are related with the decidua capsularis has been degenerated. So these chorionic villi which were related with the decidua capsularis has been degenerated, and they will form the chorion levi, because this part of the chorion has become smooth and it is called as chorion levi. And these villi towards the decidua basilis, they grow more and developed more, and this part of the chorion is called as chorion frondosum. So part of the chorion which is related to the decidua capsularis, here the finger like projections or the chorionic villi has been degenerated or regresses, and that is called as chorion levi. And the part of the chorion which is related with the decidua basilis, here the finger like projections or the chorionic villi, they grow more, and that part of the chorion is called as chorion frondosum. Now formation of the chorionic villi. Here the primary villi, secondary villi, and the formation of the tertiary villi will be there. In the first, this is the first diagram is showing the second week of the embryo. In this diagram you can see the two cavities. Upper one is the amniotic cavity and lower one is the yolk sac cavity. This is amniotic cavity and yolk sac cavity, and the trophoblast has been divided into two parts, the cytotrophoblast and the syncytiotrophoblast. Okay, so the projection of the cytotrophoblast which is covered by syncytiotrophoblast will form the primary villi. Now first what happens in the this outer one is the syncytiotrophoblast. So formation of multiple spaces that are called as lacunar spaces develops in the syncytiotrophoblast. You can see the multiple lacunar spaces in the syncytiotrophoblast, and the part between of the syncytiotrophoblast in between these two lacunar space, this part is called as trabeculae. So first the lacunar spaces, multiple lacunar spaces developed in the syncytiotrophoblast, and the part of the syncytiotrophoblast which is extending in between two lacunar spaces, that is called as trabeculae. So this is trabeculae in between two lacunar spaces, and in this trabeculae this cytotrophoblast is extending like finger like projection. So finger like projection of the cytotrophoblast into the syncytiotrophoblast lead to formation of primary villi. So at this stage the primary villi has been formed. So how the primary villi is formed? Cytotrophoblast is extending into the syncytiotrophoblast. So if we take the cut section of this area, the central part will be formed by the cytotrophoblast and periphery will be formed by the syncytiotrophoblast, and in the second week this will be formed. So that will lead to formation of primary villi. So primary villi is formed in the second week, and it is formed by the inner cytotrophoblast and outer layer is formed by the syncytiotrophoblast. So this is the primary villi formed by the cyto and outer layer is by the syncytio. This is cyto and this is syncytio. And then in the third week what happens? The extraembryonic mesoderm, which is the dark greenish one, it is extending into the villi. So that will lead to formation of secondary villi in the third week. So if we take the cut section of the secondary villi, from center to periphery it is formed by the extraembryonic mesoderm, then cytotrophoblast, then syncytiotrophoblast. And then in the extraembryonic mesoderm the fetal blood vessels will grow. So the tertiary villi is formed at the end of 3rd week. So what will be the layers of the tertiary villi? The fetal capillaries containing endothelium and blood vessels of the fetal capillaries, then extraembryonic mesoderm, then cytotrophoblast, and then the syncytial trophoblast. They will form the tertiary villi. In this diagram, implantation has been shown that first is the blastocyst which starts to implant, and then the cytotrophoblast is the outer pinkish one, and finger like projections are arising, and the syncytial trophoblast is growing into the maternal endometrium, and now the blastocyst has been completely embedded into the endometrium, and the finger like projections of the syncytial trophoblast and the cytotrophoblast will grow into it and will lead to formation of primary villi. Again in this diagram you can see the cyto and the syncytial trophoblast growing into the endometrium of the uterus and will lead to formation of primary villi. And here the endometrial blood vessels, this syncytial trophoblast will rupture the endometrial blood vessels later on. In the second diagram you can see the lacunar spaces has been formed in the syncytial trophoblast, and this syncytial trophoblast will also damage the maternal blood vessels. Now the maternal blood vessels, which are the spiral blood vessels, has been eroded and they will fill the lacunar spaces. So here in this diagram lacunar spaces has been filled by the maternal blood vessels, and the finger like projections will extend from the cytotrophoblast and the syncytial trophoblast, and it is extending in between the lacunar spaces. So the lacunar spaces later on will form the intervillous space, and the extension of cytotrophoblast with syncytial trophoblast will form the villi. And finally this brownish one is the extraembryonic mesoderm will also extend into it and then lead to formation of fetal blood vessels or the umbilical blood vessels, which will develop from the allantois and lead to formation of tertiary villi. So the intervillous space is nothing but the lacunar spaces after formation of villi, and this intervillous space we have seen that it is filled with maternal blood, and its volume is around 140 to 150 ml, and the blood flow in the intervillous space is around 500 ml per minute, and the fetal blood is flowing through the fetal or chorionic villi, and blood flow is 400 ml per minute. So the villi, chorionic villi containing the fetal blood, and the internal villus space contains the maternal blood. So now what is placental barrier or the placental membrane? It is the membrane or the barrier which is separating the fetal blood and the maternal blood. So in this diagram you can see that fetal and maternal blood, they are separated by, this is the intervillous space, this is the intervillous space which contains the maternal blood, and in the center this is the fetal blood, and they are separated by the wall of the chorionic villi. So the placental membrane is formed by, from inside outwards, it is formed by endothelial blood endothelium and the basement membrane of the fetal capillaries, then the extraembryonic mesoderm, then cytotrophoblast, and then syncytial trophoblast. Means you can say the walls of the chorionic villi or the lining of the chorionic villi will form the placental barrier because it is separating the maternal and fetal blood vessels. So placental barrier is nothing, or the placental membrane is nothing but the wall of the chorionic villi will form the placental barrier or the membrane, and it is separating the maternal and fetal blood. And one thing that maternal blood is coming from maternal side or the endometrium, and fetal blood is coming from umbilical. So both has the blood flow is side by side but in opposite direction, and they do not mix with each other because of this placental membrane, and which is made up of wall of the villi. Okay, so chorionic villi containing fetal blood, and the intervillous space containing the maternal blood, and the wall of the villi forms the placental membrane or the barrier, and all the interchanges of oxygen, nourishment and the waste products occurs through this membrane. So the barrier in early pregnancy up to the 20 week, it is formed by the endothelium of the blood vessels and its basement membrane. These are the endothelium and the blood and the basement membrane of the fetal capillaries, then the extraembryonic mesoderm, then the cytotrophoblast and the syncytiotrophoblast. They will form the barrier in early pregnancy, and then in late pregnancy after 20 week or in late pregnancy, because exchange is much needed, so this membrane will be thinned out. So there will be disappearance of the cytotrophoblast, and there will be thinning of syncytiotrophoblast. So in late pregnancy, the syncytiotrophoblast is thinned out and there will be disappearance of the cytotrophoblast. And one more thing, that the fetal blood vessels has come on the periphery. Here in this diagram you can see, in the second diagram, fetal blood vessels has come on the periphery. So finally the placental barrier or the fetal blood and the maternal blood, they are separated by endothelium of the blood vessels and the basement membrane, and the syncytiotrophoblast. They will separate the maternal and fetal blood, and it will form the barrier in late pregnancy. The same diagram which is showing the